Ever had to miss school due to sickness? Ever wondered what exactly happens when we fall ill? Well, let's dive into this fascinating world of health and disease to find out. Health, in its simplest terms, is not just the absence of any disease. It's a state of complete physical, mental, and social well-being. Imagine it as a perfect balance, a harmony within our bodies and minds, and with our surroundings. So what happens when this balance is disturbed? We encounter what is known as a disease. A disease is a condition that causes disturbances in the physiological or psychological processes of our bodies. But it's not just about feeling unwell or having a fever. Each disease has its own specific symptoms that help doctors diagnose and treat it effectively. So, disease is not just about feeling unwell, it's a disturbance in our body's normal functions. You've probably heard of diseases like diabetes, common cold, heart disease, and many more. But did you know diseases can be classified in different ways? This classification helps scientists, doctors, and even us to understand diseases better, manage them effectively, and sometimes even prevent them. Let's start with the first classification, based on duration. We have chronic diseases and acute diseases. Chronic diseases are long-term conditions. They're like those unwanted guests who overstay their welcome. Diabetes is a classic example of a chronic disease. These diseases can last for months, years, or sometimes a lifetime. On the other hand, we have acute diseases. They are short-term conditions. Think of them as the uninvited guests who thankfully don't stay for long. A common cold is a typical example of an acute disease. These diseases come quickly and usually leave quickly too, often within a few days or weeks. Now let's move to the second classification, according to reasons. We have hereditary diseases and acquired diseases. Hereditary diseases are like unwanted family heirlooms. They are passed down from parents to children through genes. Down's syndrome is an example of a hereditary disease. Acquired diseases, on the other hand, are like the troubles we pick up along the journey of life. They are not present at birth, but develop during a person's lifetime. These can be further classified into infectious and non-infectious diseases, but we'll delve deeper into that in our next scene. So, diseases can vary greatly in how long they last and why they occur. Understanding these classifications can help us better comprehend why we fall ill and how to take care of ourselves. And remember, while we can't always avoid diseases, being informed about them is a step towards better health. Knowledge, after all, is the first line of defense against any disease. But what about diseases we acquire during our lifetime? They can be split into two groups, infectious and non-infectious. Let's start with infectious diseases. These are conditions caused by organisms such as bacteria, viruses, fungi, or parasites. Many of these organisms live in and on our bodies and are normally harmless or even helpful. However, under certain conditions, they may cause disease. Examples of infectious diseases include the common cold, flu, and dengue. These diseases can spread from person to person through direct or indirect contact. Now, direct contact, you ask? Yes, it's as straightforward as it sounds. It's when an infected person physically touches another, like a handshake. It could also be through exchange of bodily fluids like saliva or blood. Indirect contact, on the other hand, involves an intermediate. This could be a mosquito bite transferring the dengue virus, or touching a surface that an infected person has touched, like a doorknob or a tabletop. But not all diseases are spread from person to person. This brings us to the second group, non-infectious diseases. These are diseases that you cannot catch from another person. They are typically a result of factors like genetics, environment, and lifestyle. For instance, heart disease is a non-infectious disease, often caused by unhealthy diet and lack of exercise. Diabetes is another example, which can be caused by genetic factors and lifestyle choices. So while you can catch a cold from your sneezing coworker, you cannot catch diabetes from your friend who has it. It's crucial to understand this distinction because it affects how we prevent and treat these diseases. With infectious diseases, we aim to break the chain of transmission through methods like vaccination or quarantine. But with non-infectious diseases, prevention often involves making healthier lifestyle choices to reduce risk factors. So some diseases can spread from person to person while others cannot. Ever wondered how diseases like hepatitis, malaria, or even a common cold spread? Well, let's dive right into it. Diseases, especially infectious ones, have a knack for getting around. They can travel through the air, hitch a ride on a mosquito, or even lurk on the surfaces we touch every day. You see, each disease has its own preferred mode of transportation, its own way of moving from one host to another. Take tuberculosis or the swine flu, for instance. These diseases like to travel through the air. When a person with such a disease coughs or spits, they release tiny droplets into the air. These droplets contain pathogens, little invaders that cause disease. Some of these droplets are so small they can hang in the air for hours, waiting for an unsuspecting host to breathe them in. Larger droplets, on the other hand, settle on the ground within seconds, but they still pose a threat to anyone who comes into contact with them. Then there are diseases like malaria and dengue, which depend on mosquitoes for their travels. This mode of disease transmission is known as vector-borne transmission. When an infected mosquito bites a person, it injects the disease-causing pathogens into that person's bloodstream, thereby transmitting the disease. Some diseases like hepatitis and dysentery take the scenic route through our food and water. Contaminated food or water can be a hotbed for these pathogens. Once ingested, they wreak havoc on our bodies, causing illness. Last but not least, we have diseases like scabies and ringworm. These love to spread through direct contact with an infected person. Sharing personal items like towels or clothing, or even a simple handshake, can be enough for these diseases to find a new host. So as you can see, diseases have quite a few tricks up their sleeves when it comes to spreading. Each has its own unique method, but they all share a common goal: to find a new host and replicate. Now, you know how important it is to practice good hygiene to prevent the spread of diseases. So, make sure to wash your hands regularly, keep your surroundings clean, and stay safe. You might have heard of the term pathogen, but what does it mean? Well, let's break this down. The term pathogen might sound a bit intimidating, but it's simply a scientific term for any organism that can cause disease. This includes certain types of viruses, bacteria, and even some fungi. Now let's imagine our bodies as a fortress. We have various defenses in place to keep us healthy. Our skin acts like a wall, blocking out most of the pathogens, and our immune system is like the guards, always on the lookout for any invaders. But sometimes a sneaky pathogen manages to get past our defenses and causes an infection. This is where the term infectious diseases comes in. These are diseases that are caused by pathogens. They can spread in various ways, through contaminated air, water, food, or even certain animals and insects. Let's take the example of the common cold. It's caused by a virus, which is a type of pathogen. When someone with a cold sneezes, they release tiny droplets into the air. These droplets contain the cold virus. If you happen to breathe in these droplets, the virus can enter your body and cause an infection. But not all pathogens are airborne. Some, like certain bacteria, can survive on surfaces and objects for a while. If you touch a contaminated surface and then touch your face, you could potentially introduce the bacteria into your body. Now let's talk about those pesky mosquitoes. Certain types of mosquitoes can carry pathogens for diseases like malaria and dengue. When they bite you, they can transmit these pathogens into your body. So, you see, pathogens can be quite crafty. They have various ways of bypassing our defenses and causing diseases. But don't worry, our bodies are quite amazing too. With a good diet, regular exercise, and proper hygiene, we can strengthen our defenses and keep those pathogens at bay. So, pathogens are the bad guys that cause infectious diseases. But remember, we're equipped with the tools to fight them off and stay healthy. Let's take a moment to recap what we've learned today. We started off by defining health, not just as the absence of disease, but as a state of complete physical, mental, and social well-being. We then delved into understanding what a disease is, essentially a disturbance in our body's physiological or psychological processes. We classified diseases based on their duration into acute and chronic, and also on the basis of their origin into hereditary and acquired. We further broke down acquired diseases into infectious and non-infectious types. We explored how various diseases spread, be it through air, water, food, or even vectors like insects. Lastly, we touched upon pathogens, those pesky agents that cause disease. Be they viruses, bacteria, or other organisms, they are the culprits behind infectious diseases. Understanding these concepts is the first step towards maintaining good health. Remember, prevention is always better than cure.
Ever wondered what tuberculosis is and how it spreads? Tuberculosis, often just called TB, is an infectious disease caused by a pesky pathogen known as Mycobacterium tuberculosis. It's a global health issue that affects millions. Stay tuned to understand more about this infectious disease. So how does this disease spread? Well, tuberculosis, caused by Mycobacterium tuberculosis, is highly contagious. It spreads when a patient spits, by air, and through prolonged contact. Even sharing materials with a patient can lead to infection. Remember, tuberculosis is a highly contagious disease. What symptoms should you look out for? Tuberculosis often presents with a persistent cough, sometimes accompanied by bloody spittle. Extreme weight loss, known as emaciation, is another sign, along with difficulty in breathing. Identifying these symptoms early can lead to effective treatment. So, how can we prevent and treat tuberculosis? The key methods involve the BCG vaccine, isolating the patient, and regular medication such as directly observed therapy. These measures can significantly reduce the risk and impact of the disease. Prevention is always better than cure, especially when dealing with tuberculosis. Let's recap what we've learned. Tuberculosis, caused by Mycobacterium tuberculosis, spreads through spitting, air, and prolonged contact. Symptoms include a chronic cough, bloody spitting, extreme weight loss, and difficult breathing. Prevention includes the BCG vaccine, patient isolation, and regular medication like DOT. Remember, understanding tuberculosis and its prevention methods can help us combat this contagious disease effectively. Welcome to a deep dive into the world of hepatitis, commonly known as jaundice. This condition is caused by various strains of the hepatitis virus, A, B, C, D, and E. But how does one contract hepatitis? It's often through contaminated water, the sharing of needles, or blood transfusions. Hepatitis tends to sneak up on you with symptoms that can be easily overlooked. These include anorexia, or lack of appetite, yellow urine, general weakness, nausea, vomiting, and gray stools. Now, million-dollar question: how do we prevent and treat hepatitis? The answer is simpler than you might think. Drinking boiled water and maintaining rigorous hand hygiene are your first line of defense. Remember, knowledge is power. Stay informed, stay healthy. Until next time, keep exploring the world of health and wellness.
Picture this. A stealthy invader lurks in contaminated food and water, ready to disrupt your life. The villain? Dysentery, caused by bacteria or viruses, specifically Shigella, Bacilli, and Entamoeba histolytica. Once inside the body, it wages war, triggering discomforting symptoms like watery stool and abdominal pains. It might sound like a nightmare, but there's a silver lining. Prevention and treatment are within reach. Arming yourself is simple. First up, always drink boiled water. It's an easy yet effective way to keep the invaders at bay. Next, proper storage of food is crucial. This simple step ensures the disease-causing organisms don't find a foothold. Lastly, if the invaders do breach your defenses and dysentery takes hold, don't despair. Consuming oral rehydration salts, commonly known as ORS, can help restore the body's fluid balance and hasten recovery. Remember, knowledge is power. Stay informed, stay healthy.
Welcome to a world of knowledge, where we demystify complex topics for you. Today we dive into a serious health concern, cholera. This disease is caused by a bacterium known as Vibrio cholerae. Wondering how it spreads? The primary culprits are contaminated food and water. The onset of cholera can be quite sudden, with symptoms like vomiting, severe diarrhea, and leg cramps. But don't worry, prevention is possible. Adhering to hygienic practices, avoiding food from open places, and drinking boiled water can keep this disease at bay. What's more, there's also a vaccination against cholera. So, arm yourself with knowledge and stay safe from cholera. Remember, prevention is always better than cure. Until next time, keep exploring, keep learning.
Imagine an invisible enemy lurking in your food and water. It's called Salmonella typhi, the bacterium responsible for the disease known as typhoid. Its primary mode of infection? Contaminated food and water. And once it's in your system, it starts wreaking havoc. The symptoms are not for the faint-hearted: a sudden loss of appetite, crippling headaches, and a peculiar rash on the abdomen. Add to that dysentery and a fever that can spike up to a staggering 104 degrees Fahrenheit. But there's hope. Prevention and treatment of typhoid are within our grasp. It starts with simple steps: drinking clean water and ensuring proper disposal of sewage. And let's not forget the power of vaccination. Together we can keep this enemy at bay and safeguard our health. Remember, knowledge is power. Stay informed, stay healthy.
Ever wondered what lurking dangers are hidden in a single mosquito bite or a handshake? In our ever-evolving world, diseases have become silent yet potent threats to our health and well-being. They can strike at any moment, disrupting our lives in ways unimaginable. Among the plethora of diseases that exist, some have managed to leave a significant impact globally. Let's talk about dengue, a disease spread by the Aedes aegypti mosquito, and the result of a virus known as Den 1-4, part of the flavivirus family, or perhaps malaria transmitted by the female Anopheles mosquito. And we mustn't forget swine flu, an infection that can pass between pigs and humans, causing breathing difficulties and body pains. Lastly, AIDS, a disease caused by HIV, the human immunodeficiency virus, which weakens the body's natural immunity, making the victim susceptible to various other diseases. Let's dive into the world of these diseases and their symptoms. Imagine a tiny mosquito causing havoc in your body. Welcome to dengue, a disease that's not as small as the creature that transmits it. Dengue, a viral illness, is spread through the bite of a specific mosquito, the Aedes aegypti. Now, let's dive into the cause of dengue. This disease is the result of a virus known as Den 1 to Den 4, all part of the flavivirus family. These viruses are not something you'd find just anywhere. They are carried and transmitted by mosquitoes, particularly the Aedes aegypti. This mosquito species has a knack for thriving in areas where water collects, such as flower pots, discarded tires, or any other object where rainwater gathers. When an Aedes aegypti mosquito bites a person infected with dengue, it becomes a carrier of the virus. The next time this mosquito bites a human, it can transmit the disease to that person. This cycle of transmission can result in outbreaks of dengue, especially in urban areas with high mosquito populations. So how would you know if you've contracted dengue? Well, the symptoms can be quite severe. The onset of dengue often starts with a high fever and headache, but it doesn't stop there. You might also experience vomiting and a distinctive pain in the eye sockets. One of the most critical symptoms of dengue is a decrease in platelet count. Platelets are a type of blood cell that helps your body form clots to stop bleeding. A significant drop in platelets can lead to a severe form of dengue, known as dengue hemorrhagic fever, which can cause bleeding, blood plasma leakage, and low platelet count. This severe form of dengue can be life-threatening and requires immediate medical attention. Now you know why those pesky mosquitoes can be a real pain. Remember, if you or anyone around you experiences these symptoms, seek medical help immediately. Dengue is not a disease to be taken lightly. Prevention is better than cure, so let's work together to eliminate mosquito breeding sites and protect ourselves and our communities from the threat of dengue. From one mosquito-borne disease to another, let's talk about malaria. This deadly disease is not spread by just any mosquito, but specifically by the female Anopheles mosquito. It's fascinating and a bit terrifying that such a tiny creature can cause so much havoc. Now, if you're thinking, I'll just stay away from dirty water and I'll be safe, I'm afraid I've got some bad news. Anopheles, like her cousin Aedes, the dengue-spreading mosquito, actually prefers clean water to breed in. That's right. Those pristine, clear puddles and pools are prime real estate for these disease-spreading pests. But it's not all bad news. By understanding how these mosquitoes breed and spread disease, we can take steps to protect ourselves and our communities. It all starts with education and awareness. Remember, clean water might not always mean safe water as far as mosquitoes are concerned. Moving from mosquitoes to pigs, let's discuss swine flu. Swine flu, also referred to as H1N1 virus, is a respiratory disease that originates from pigs but has the potential to infect humans. The virus is transmitted through secretions of the nose, throat, and saliva. But don't worry, you can't get it from eating pork. It's spread from person to person, much like the regular flu. The symptoms of swine flu can be deceptively similar to that of a common flu. This includes difficulty in breathing, sore throat, and body pains. It may also involve fever, cough, and a runny or stuffy nose. In some cases, it can even cause nausea, vomiting, and diarrhea. However, it's important to remember that not everyone with flu will have a fever. Diagnosing swine flu can be a bit tricky due to its similarity with other types of flu. Typically, a sample of fluid from the patient's throat is sent to a laboratory for testing. In India, diagnostic facilities are available in the National Institute of Virology in Pune and the National Institute of Communicable Diseases in Delhi. Swine flu might seem like a recent phenomenon, but the first case was reported over a decade ago, in Mexico, in 2009. It was a global pandemic, causing widespread illness and death. It's not just a disease of pigs, it's a human disease that we must take seriously. Influenza viruses constantly mutate and change, which means new strains of swine flu can emerge that humans have little to no immunity against. This makes vaccination and public health surveillance critically important. If you feel unwell, have high fever, cough, or sore throat, stay at home and contact a healthcare provider. Remember, swine flu is more than just a seasonal flu. It's a serious disease that can cause severe illness and even death. So stay informed, practice good hygiene, and seek medical care when necessary. Now let's talk about a disease that has created fear and stigma: AIDS. This is a condition brought about by the human immunodeficiency virus, or HIV. The virus attacks the immune system, the body's natural defense against disease. Over time, as the immune system weakens, the individual becomes more susceptible to a range of illnesses. The symptoms of AIDS are not universal, they vary from person to person. Some might experience flu-like symptoms in the initial stages, others might not exhibit any symptoms for years. However, the only surefire way to know if you have AIDS is through medical testing. One of the most commonly used tests is the ELISA test, or the enzyme-linked immunosorbent assay test. Now let's address some misconceptions. One of the biggest fallacies surrounding AIDS is how it's transmitted. Many people live under the misapprehension that AIDS can be contracted through touch or sharing meals with an HIV-infected person. This is absolutely false. HIV is primarily transmitted through unprotected sex, sharing of needles, or from mother to child during childbirth or breastfeeding. It is not an airborne or foodborne virus, and it cannot survive long outside the human body. Another misconception is the belief that only certain groups of people can contract HIV. HIV does not discriminate. Anyone can be infected regardless of age, gender, race, or sexual orientation. A third misconception is that an HIV diagnosis is a death sentence. This is far from the truth. Yes, AIDS is a serious condition and currently has no cure. But with today's advancements in antiretroviral therapy, HIV can be managed as a chronic disease, allowing individuals to live long, healthy lives. AIDS is not just a medical condition, it's a social issue requiring empathy and understanding. It's crucial to dispel these misconceptions to combat the stigma associated with AIDS. Remember, change begins with education, and knowledge is power. Scene script: knowing about these diseases is half the battle, but what can we do about it? Let's talk about prevention measures for each disease and emphasize the importance of education in disease prevention. To combat dengue, we can start by eliminating stagnant water sources where mosquitoes lay their eggs. This includes flower pots, old tires, and even small puddles. Insect repellent can be used to keep mosquitoes at bay. Remember, it's a community effort. For malaria, the prevention strategies are similar. However, another key element is the use of insecticide-treated mosquito nets, which can dramatically reduce the risk of transmission. Swine flu prevention is a bit different, as it's spread through secretions of the nose, throat, and saliva. Regular hand washing, avoiding close contact with sick individuals, and wearing a mask in crowded places can help. Vaccination is also a viable option. Now, AIDS is a unique case. It's essential to know that HIV, the virus causing AIDS, doesn't spread through casual contact. It's transmitted through unprotected sex, sharing needles, or from mother to child during birth or breastfeeding. So safe practices and regular testing are key to prevention. But how do these prevention measures tie in with education? Well, education is the cornerstone of disease prevention. The more we understand about these diseases, the better we can protect ourselves and others. It's important to dispel myths, like the misconception that HIV can spread through casual contact. Education is also about knowing your resources. For instance, are you aware of what measures your local authorities are taking for mosquito control? It's crucial to engage with them and make sure they're doing their part. The same goes for understanding how to behave with HIV-infected persons. Remember, they are not to be stigmatized or discriminated against. They're just like anyone else, and they deserve our respect and empathy. In conclusion, the power to prevent these diseases lies in our hands. It starts with you, with your actions, your choices, and your willingness to learn and share information. Remember, prevention is always better than cure. Stay informed, stay healthy.
Ever pondered about the link between animals and our health? It's more significant than you might think. Our daily life is shared with animals, from the pets we cherish to the pests we try to control. The health of these animals, whether they're our beloved dogs and cats or uninvited rats, can directly impact our own. For instance, rats and other pests can carry diseases harmful to humans, making pest control a matter of public health. On the other hand, domestic pets, if not properly cared for, can also pose health risks. Take rabies, for example. This viral disease is often transmitted through the bite of an infected animal. It could be a dog, a cat, even a rabbit or monkey. The virus travels to the brain, causing symptoms that can be as terrifying as they are fatal. Rabies, a fatal disease, is just one example of how animal health affects us. Rabies isn't just a dog's disease. Did you know that it can be transmitted by rabbits, monkeys, cats, and more? This viral disease is a silent invader, entering the brain via neurons after a bite from an infected animal. One of the most telling symptoms of rabies is hydrophobia, an intense and irrational fear of water. Rabies is indeed a fatal disease, but its fatality isn't set in stone. It's crucial to understand that timely vaccination before the onset of symptoms can prevent the worst. Symptoms usually start to appear within 90 to 175 days after the bite. These may include a fever that can last between 2 to 12 weeks, and exaggerated changes in behavior. Remember, rabies is preventable with the right precautions and timely medical intervention. Knowledge is your greatest weapon in this fight, so stay informed and stay safe. Not all diseases come from outside. Some are born within us, like cancer. These are what we call non-infectious diseases. They don't pass from one person to another, but arise within our own bodies due to various factors. Let's take the example of cancer. It's essentially an uncontrolled and abnormal growth of cells, creating a lump or group of cells known as a malignant tumor. These can occur in various organs, from our lungs and mouth to our stomach, breast, uterus, skin, and even our blood tissues. Now, what causes cancer? It could be a number of things, from lifestyle habits like tobacco and alcohol consumption, smoking, and excessive junk food intake, to a lack of fiber-rich foods in our diet. In some cases, it's simply down to our genes. Yes, heredity can be a reason too. Cancer is a battle fought on multiple fronts, from prevention to diagnosis and finally treatment. Detecting cancer early significantly increases the chances of successful treatment. Cancer, an uncontrolled and abnormal cell growth, can strike various organs and tissues, presenting itself in many forms. But how do we detect cancer? Today, medical professionals rely on a gamut of techniques to diagnose this disease. Computed tomography or CT scans, for instance, provide detailed images of the body's internal structures, helping doctors to spot any unusual growths. Magnetic resonance imaging or MRI scans offer even more detailed images, especially helpful for detecting brain and spinal cord tumors. Mammography is used specifically for detecting breast cancer at its earliest stages, even before any physical symptoms appear. In some cases, however, these imaging techniques may not provide a definite diagnosis. That's where a biopsy comes in. A biopsy involves removing a small sample of tissue for examination under a microscope. Pathologists can then identify whether the cells are cancerous, and if so, the type and grade of the cancer. Once a cancer diagnosis is confirmed, it's important to consider the various treatment options available. Traditional methods have long included chemotherapy, radiation therapy, and surgery. Chemotherapy uses drugs to kill cancer cells, while radiation therapy uses high-energy particles or waves to do the same. Surgery, on the other hand, physically removes the cancer from the body, but modern technology has brought us even more advanced ways to combat cancer. Robotic surgery, for instance, allows for more precise operations with less damage to healthy tissues. Laparoscopic surgery, also minimally invasive, involves making small incisions and using a tiny camera to guide the procedure. While these treatment options can be powerful tools against cancer, they are often most effective when the disease is caught early. That's why regular health checks and awareness of potential symptoms are so important. Remember, prevention is always better than cure, especially when it comes to cancer. By maintaining a healthy lifestyle, avoiding known carcinogens, and getting regular screenings, we can each play an active role in our own health and well-being. Have you noticed someone avoiding sweets or drinking sugar-free tea? They might be one of the millions battling diabetes. This is a silent epidemic that affects a large chunk of our population. To understand diabetes, let's first talk about insulin. It's a hormone produced in our pancreas. Its main function? To control the level of sugar, or glucose, in our blood. Think of insulin as the key that opens the cells in our body, allowing glucose to enter and be used for energy. But sometimes the body either doesn't make enough insulin or doesn't use it properly. When this happens, glucose stays in the blood, causing blood sugar levels to rise. This disorder, my friends, is known as diabetes. Now let's talk about the symptoms. They may vary from person to person, but there are some common ones that can't be ignored. These include frequent urination, especially at night, and unexplained weight change, whether it's gain or loss. Other signs might be constant thirst, extreme fatigue, or blurred vision. So what causes diabetes? Well, there are several factors. Heredity plays a role, meaning if it runs in your family you have a higher risk. Obesity, too, is a key factor. Lack of physical exercise and mental stress can also contribute to the development of this disease. Now the million-dollar question: can diabetes be prevented? While there's no surefire way to completely prevent it, there are measures to lower the risk. A balanced diet, regular physical activity, and maintaining a healthy weight are crucial. If diagnosed, following your doctor's advice about diet, exercise, and medication can help manage the condition effectively. India currently holds the dubious distinction of having the highest number of diabetes patients in the world, around 70 million. That's a staggering number, underscoring the urgency of this silent epidemic. With proper lifestyle changes and medical supervision, diabetes can be managed effectively. Remember, knowledge is power. The more we understand about diabetes, the better equipped we are to fight it. To recap, both animals and our own bodies can be sources of diseases. We've delved into the world of infectious diseases like rabies, transmitted through animal bites, emphasizing the importance of timely vaccination. We've also discussed the health implications of domestic animals and pests, highlighting the need for proper animal care and pest control. Shifting gears, we explored non-infectious diseases, which arise from within our own bodies. We took a deep dive into cancer, a disease characterized by abnormal cell growth, and discussed its causes, symptoms, and modern diagnostic and treatment methods. We also touched upon diabetes, a disorder caused by inadequate insulin production, and the importance of diet, exercise, and medical supervision in managing this condition. The key takeaway here is the critical role of prevention and early detection. Whether it's ensuring our pets are vaccinated or going for regular health checkups, proactive measures can go a long way. Remember, your health is in your hands. Stay informed, stay vigilant, and stay healthy.
Have you ever wondered what happens when the heart can't get the nutrients it needs? A well-functioning heart relies on a constant supply of blood, which carries vital oxygen and nutrients. When this supply decreases, the heart's efficiency begins to falter. It's similar to a car running low on gas. It can't perform optimally, and eventually it may even break down. This is essentially what happens in the case of heart diseases. The heart, undernourished and overworked, is put under tremendous stress. The end result could be as severe as a heart attack. Yes, it's as serious as it sounds. This is why immediate medical attention is crucial if one experiences symptoms indicative of heart problems. Ignoring symptoms such as severe chest pains, cramps, and uneasiness can have serious consequences. It's as if you're seeing the fuel light on your dashboard but choosing to ignore it. The consequences, needless to say, can be disastrous. So, what causes heart diseases? Well, the heart is a tireless worker, pumping blood, oxygen, and nutrients throughout our body. But when the heart's supply of these essentials is decreased, it has to work overtime, leading to stress. This undue stress on the heart can cause a heart attack. Now, let's delve into the myriad of factors that can lead to heart diseases. A major culprit is lifestyle choices, such as smoking and alcoholism. Both these habits can wreak havoc on your heart health, leading to decreased blood flow and increased heart strain. Health conditions like diabetes and hypertension also play a significant role in heart disease. Diabetes affects the way your body processes sugar, which can lead to damage to your blood vessels and nerves that control the heart. Hypertension or high blood pressure makes your heart work harder to pump blood, which can lead to heart disease over time. Obesity is another key player in heart disease. Excessive weight puts additional stress on the heart, increasing the risk of heart disease. Lack of physical exercise also contributes to heart disease. Regular physical activity helps maintain a healthy weight and lowers blood pressure, reducing the risk of heart disease. Genetics can also predispose an individual to heart disease. If heart disease runs in your family, you may be at a higher risk. Mental stress, anger, and anxiety can also contribute to heart disease. These emotional states can trigger an increase in heart rate and blood pressure, which over time can damage the heart and lead to disease. It's important to recognize symptoms like severe chest pains, pains in the shoulder, neck and arms, cramps in the hand, uneasiness, and tremors. Ignoring these signs could lead to serious consequences. Heart diseases can be triggered by a multitude of factors, but they are not inevitable. By understanding these causes and making conscious choices to mitigate them, we can take steps towards heart health. Let's talk about what to do if someone experiences a heart attack. The very first thing you should do is dial your local emergency number for an ambulance. In many places, that number is 108. Next, check the patient's level of consciousness. You can do this by gently shaking their shoulders. If they're unresponsive, lay them on their back on a hard surface. Now, it's time to perform what's known as compression-only life support, or KOLS for short. This involves pressing the center of the patient's chest, specifically the thorax, rapidly and repeatedly. Aim for at least 30 compressions at a rate of between 100 and 120 strokes per minute. In these situations, every second counts, but it's also important to stay calm. You could be the difference between life and death. It's crucial to act quickly and calmly in these situations. What happens after a heart attack? What are the treatment options? Once a heart disease diagnosis has been made, it's crucial to understand that this is not the end. In fact, a whole realm of treatment options opens up, each tailored to the unique circumstances and needs of the patient. Some of the most common treatment routes include angioplasty, heart transplant, the installation of stents, and the installation of a pacemaker. Let's start with angioplasty. This is a minimally invasive procedure where a small balloon is used to open up clogged heart arteries, allowing blood to flow more freely to the heart. Sometimes a small wire mesh tube called a stent is also placed in the artery during angioplasty to keep it open long term. Next, we have heart transplants. This is a major surgical procedure where a diseased heart is replaced with a healthy heart from a deceased donor. It's a treatment option usually reserved for those with end-stage heart failure, when all other options have failed. The installation of stents is another common treatment. Stents are small, expandable tubes that are used to treat narrowed or weakened arteries in the body. They can be used to prop open an artery and are often placed during or immediately after angioplasty to help prevent the artery from closing again. The installation of a pacemaker, a small device that's placed in the chest or abdomen to help control irregular heart rhythms, is another treatment option. This device uses electrical pulses to prompt the heart to beat at a normal rate. Other treatment methods include open heart surgery and bypass surgery. Open heart surgery is any type of surgery where the chest is cut open and surgery is performed on the muscles, valves, or arteries of the heart. Bypass surgery, or coronary artery bypass grafting, improves blood flow to the heart by using a vessel from another part of the body to bypass a blocked artery. Remember, a heart disease diagnosis is not the end. There are numerous treatment options available. No matter the path you or a loved one may find yourself on after a heart disease diagnosis, remember that medical advancements are continually providing more and more ways to treat and manage heart disease. What role do medicines play in the treatment of heart diseases? This question might seem straightforward, but the answer is multifaceted. Medicines, quite simply, are vital in the treatment of heart diseases. They are used to manage symptoms, prevent complications, and improve quality of life. They can also be life-saving in acute situations, such as a heart attack. But not all medicines are created equal. There is an important distinction between generic and branded medicines. Generic medicines, also known as general medicines, are manufactured and distributed without a patent. They are just as effective and safe as their branded counterparts, but often at a fraction of the cost. This is because their production costs are lower, as they don't require new research or marketing. They use formulas that are already available, which makes them a more affordable option for many. However, it's crucial to remember that medicines are powerful tools and should be used responsibly. Misuse of medicines can lead to serious consequences. For instance, taking medicines without a doctor's prescription or taking more than the prescribed dose can harm our bodies. Overdosing on painkillers, for example, can damage the nervous system, excretory system, and liver. An overdose of antibiotics may lead to nausea, stomachache, dysentery rashes, and white patches on the tongue, among other things. So, while medicines play a crucial role in treating heart diseases, they are not a solution in and of themselves. They need to be used as part of a comprehensive treatment plan under the supervision of a healthcare professional. And remember, there's no one-size-fits-all when it comes to medication. What works for one person might not work for another, so it's essential to have open, ongoing conversations with your healthcare provider to find the best treatment plan for you. Medicines are a crucial part of the treatment process, but they must be used responsibly. Whether it's a branded or generic medicine, it's a powerful tool in the fight against heart disease. But like any tool, it's only as effective as the person wielding it, so use it wisely under the guidance of your healthcare provider. How does our lifestyle influence our health? This question is becoming increasingly important in our modern world. Our daily habits, diet and exercise routines significantly impact our health and the likelihood of developing diseases, especially heart diseases. Today's trends, such as staying in bed late into the morning, inconsistent meal timings, a lack of physical exercise, and frequent consumption of junk food, have led to a rise in health issues. These lifestyle choices can lead to decreased heart efficiency, causing more stress on this vital organ and increasing the risk of heart attacks. So, what's the solution? A healthier lifestyle, adequate sleep, nutritious food, regular physical exercise within one's capacity, and practices like yoga and pranayama under expert supervision can help maintain a healthier body and mind. Remember, a healthy lifestyle is the best preventive measure against heart diseases. It's not just about living longer, it's about living better. So, let's prioritize our health and make choices that serve us well. Finally, let's talk about the role of vaccination in preventing diseases. Vaccines are remarkable tools that help prepare our bodies to fight off potential invaders. They work by introducing a weakened or harmless piece of a virus or bacteria into our system. This doesn't make us sick, but prompts our immune system to produce antibodies, our body's own little warriors. These antibodies then remember how to fight off these invaders if we ever come into contact with them in the future. Vaccinations play a pivotal role in controlling and even eradicating many infectious diseases that were once common and deadly. They protect not only ourselves, but also those around us, especially those who are unable to get vaccinated. This is what we call herd immunity. Remember, vaccination isn't just about individual health, it's about the health of our community. Vaccination is a vital tool in our fight against infectious diseases.
Ever wondered how the Indian government is ensuring affordable healthcare for its citizens? The answer lies in a significant initiative known as Pradhan Mantri Jan Aushadhi Yojana. This scheme was launched by the Government of India on the 1st of July 2015. The primary goal of this initiative, to ensure that the citizens of India have access to the best quality medicines without having to worry about the cost. But how is this achieved? Enter the Jan Aushadhi stores. These stores, launched as part of the Pradhan Mantri Jan Aushadhi Yojana, are instrumental in making these affordable yet high-quality medicines available to the public. Through this scheme, the government is working tirelessly to ensure that healthcare doesn't remain a luxury, but becomes a right that every citizen can enjoy. This scheme is a groundbreaking step towards affordable healthcare in India. Did you know that Indian pharmaceutical companies are making a global impact? Indeed, they're at the forefront of exporting generic medicines on a large scale. But here's a twist. These same medicines are often sold under branded names at higher prices within India itself. A stark contrast to the American approach, where a whopping 80% of medicines used are generic, a strategy that results in significant savings. Think about it. From the total medication consumed in the United States, 4 out of every 5 pills are generic. This has led to a savings of hundreds of billions of dollars. It's a clear indicator of the power of generic medicines in promoting accessibility and affordability of healthcare. In India, the scenario is gradually changing with initiatives like the Pradhan Mantri Jan Aushadhi Yojana, aiming to provide quality medicines at affordable prices. Clearly, there's a lot to learn from the global approach to generic medications. Awareness is the first step towards better health, and what better way to spread awareness than celebrating Health Awareness Days? The 7th of April is World Health Day, a chance to promote global health awareness. Fast forward to the 14th of June, it's World Blood Donation Day, encouraging us all to give a life-saving gift. The 29th of September is World Heart Day, focusing on heart health, and the 14th of November is World Diabetes Day, raising awareness about this prevalent disease. Remember these dates and join in the global celebrations of health awareness. Have you ever thought about the impact of a single act of blood donation? Imagine this. 1 unit of your blood can potentially meet the needs of 3 different individuals. How? It's because your blood can be separated into red blood cells, white blood cells, and platelets, each serving a distinct need. Now, imagine donating blood 4 times a year. That's potentially 12 lives saved. 12! The power to save lives is in your hands. Consider donating blood.